Hi, my name is Chirag Shah, and I'm the co-founder of Rapidocc. Let me introduce you to Dr. Danny Sands. Last week, Dr. Sands was at his daughter's soccer game. While at this soccer game, Dr. Sands received 3 phone calls. The first phone call was about an appointment reschedule. He simply handled this phone call by simply calling back. The second phone call was about a prescription refill. He simply had to ask where that patient was and the preferred pharmacy. The third phone call was about a medical question. Now, when Dr. Sands responded to this, not only was it not just one question, but a set of questions. He had to find out how that patient was feeling, the background of that patient, and the best way to provide care after hours for that patient. In total, it took 25 minutes for this entire conversation. Now add this to the fact that the other 2 phone calls took 5 minutes. For half of his daughter's soccer game, Dr. Sands was attending the phone calls. Now this may seem like a very atypical situation to us, but this is common for primary care providers such as Dr. Sands. On average, Dr. Sands and his fellow practitioners take care of 2,300 patients. Estimates suggest that if all adult primary care providers were to provide all acute, preventative, and chronic care to all of their patients, it would take them 22 hours per day. And add this to the fact that since the Affordable Care Act was enacted, 30 million new patients have been added to the healthcare system. And as our population ages, they need more and more after-hours help. On average, the elderly call 2 to 3 times more than the common patient. Now, doctors and private practices have handled this problem by hiring additional help, such as nurse practitioners or physician's assistants. But after hours, they're still using an archaic answering service. This is the same answering service that takes calls for utilities, small businesses, and even your local lawn mowing service. When a patient calls for after-hours help, they talk to a call operator. This call operator takes down a few notes and creates a small summary. The summary includes contact information and a vague explanation about what that patient is experiencing. They then send all calls, regardless of urgency, to the doctor. The doctor then responds with the little information that he or she has, and then has no way of documenting immediately what that patient and that doctor had conversed about. Now, what's the easy, simple solution to this problem? It's Rapidocc. Rapidocc is an automated software solution that streamlines and improves after-hours care for providers and patients. Now when a patient calls after hours, they simply interact with our automated solution. We separate the calls based on urgency, and only 30% of the calls get to the doctor. The doctor then has point of contact information and medical background history. Hence, that doctor knows how that patient is feeling and the background of that patient. They then call with all that information at hand and provide that care that that patient deserves. Once the entire interaction is complete, that doctor can immediately jot down all the important notes in the application. As a result of using Rapidocc, providers are able to spend less time responding to phone calls, but also less time documenting phone calls. And due to the fact that with Rapidocc, they can provide better after-hours consultations, they also reduce the need for follow-up appointments, hence increasing practice savings. And the patient also benefits. Due to the fact that we allow the doctor to jot down all the important notes, we increase care continuity across the entire healthcare system. Based on our interviews and conversations with 50-plus doctors, nurses, and care coordinators, what we've discovered is that the most urgent need is in the primary care market. Primary care physicians are your geriatricians, pediatricians, family practitioners, and internal medicine doctors. These types of practitioners receive 7 to 10 phone calls each evening, and each call lasts anywhere from 5 to 10 minutes. Out of the 830,000 physicians in this country, 325,000 are primary care providers. And not only do we provide them with a modern tool to better handle their after-hours call flow, we do it at a much more affordable rate. Currently, traditional answering services are charging up to $350 per month to simply answer a phone call, take down a short summary, and then notify the phone call. At Rapidocc, we will charge $59 per month and include all of these great features. This year, we've been able to accomplish a lot. In the spring of 2016, we assembled our team. We immediately began to converse with our prospective customers and collaborate with them to develop the first version of our product. In the summer of 2016, we went to the market to test market demand and product functionality. We were able to garner interest from 6 pilot customers in Brevard County, Florida. Based on the feedback I've received, on-call providers are able to provide more effective care due to the amount of information we've given them. And office managers and other staff are able to simply respond to their appointments or prescription refills during office hours. But what we're most excited about is that this summer, we were able to partner with Athena Health. By partnering with Athena Health, not only will we increase our brand legitimacy, but we'll also be able to increase our distribution channel and leverage their network to access over 40,000 primary care providers. In the fall of 2016, we will be partnering with Greenway Health and Allscripts, similar medical technology companies to Athena Health. After these 3 partnerships, we'll have access to over 100,000 medical providers. To lead this effort, we've assembled a team with a varied skill set. I myself have 5 years of experience as a financial analyst. My partner Ashok has 10 years of experience as a software developer, and our advisors have experience in practice management, care coordination, and HIPAA compliance, which is a regulatory requirement. And we've also partnered with WB Software Lab to scale quickly, and also a physicians association so that we can receive continuous feedback. Now, we know that the healthcare landscape is shifting, and that physicians will be overwhelmed by the amount of patients that they must see during office hours and after hours. At Rapidocc, we hope to lighten this burden by not only providing them a modern tool to better care for their patients, but also to help them reclaim their time. Currently, we're looking for pilot customers in the New England area, and also advisors who have experience in medical technology, medical insurance, and medical law. If you have any other questions, comments, or simply want to discuss Rapidocc with us, please visit us at our booth. Thank you.